It's live now.
All right. Cool. I think we're for sure live on Facebook. It looks like we might be having some problems on LinkedIn. So I'll figure that out maybe later as we build this ship. Build the plane while we're flying it. But I appreciate everyone who's joining in right now or who might be viewing this after it's gone live. My name is Colin McGrew. My pronouns are he, him, his. I'm a program partner with Inclusive Communities, and I'm super excited to be here with this virtual table talk session. And I'm joined here by some great people that I'm looking forward to have some conversations with. So do you all want to introduce yourselves?
Sure.
Yeah.
I guess I'll go first. So I want to say Ampatu Washte, Chante Washte na Pekshi Zati, Ampo Mini Boja Denia na Washichu ya Misty Frazier, Misty Thomas Frazier na Katie. Na Insan da Makota na Habu Wakbada Edwati. So I said good day to all of you. My name, I shake your hand with a good heart. So my Dakota name is Ampo Miniboja, which translates to Misty Dawn, which also is my English name. And so I come from the Thomas family here in Santee. So I live and work on my home reservation in Northeast Nebraska, and which I feel like I'm very fortunate in that way. And what else did I say? I think that's about it. I said I live in the Hobo Creek district of our reservation. So that's Hobo Wakbada. And so I'm just really happy to be here. Thank you for having me.
Awesome.
Hamadakia fi Chante Washte na Pekshi Zati na Lilada Yaya Hippie. La Komi Chasaki, we are Washte Machipi, no Washichu. Kendra he haka kita macha picture. Si chong komo kocha amata na shunka khi Manila zuha shunka haka abatia. Wana Dartmouth College, Alabama. Sure. Hello everyone. I greet each and every one of you with a warm heart virtually. My name is Lovely Feminine Girl, woman, and my government name is Kendra Elklicksback, or Hechaka Hakikta, pronouns she, her, hers, and I come from the Rosewood Sioux tribe. That's the federally recognized name, otherwise known as the Sichongu Lakota Oyate, or the Berkshire Nation. And yeah, I live in Hedog, South Dakota, under the Rosewood Reservation. But currently, I'm in my dorm room at Dartmouth College, and I was a volunteer for Inclusive Communities.
Awesome. Perfect. Well, thanks, Misty and Kendra. And again, I'm super excited to be sitting down virtually, having this conversation with you all. And so, yeah, that's kind of this first question is directed towards you, Misty. And I just didn't know if you wanted to kind of give us a little bit of background in the work that you do with the Nebraska Indian Child Welfare Coalition, and kind of what does that work look like? And maybe too, how has that work had to pivot or transition due to the current context of the COVID-19 pandemic?
Yes, definitely. I would love to talk about the coalition. So it's the Nebraska Indian Child Welfare Coalition. So it's not the national. I think that's what you said. But anyway, we're based out of Nebraska. We're a statewide nonprofit organization. We grew out of a grassroots organization where it really started by the tribes and some attorneys and people that have a vested interest in Indian child welfare. We just kind of getting together and talking about what are the issues and all of that. And so we started that in 2008, and we actually just achieved nonprofit status in July 2019. So we are a pretty brand new nonprofit organization, and And so we have a couple of taglines and slogans that we use. Indian children culturally connected, rights protected, and we educate, advocate, and bring people together, and really to improve the lives of Native children and families in the state of Nebraska. We are a Nebraska-based nonprofit, but we also serve Woodbury County, Iowa, because it's just right across our borders, and like our tribes in Nebraska have a lot of implications in Woodbury County, Iowa, which is Sioux City, Iowa. So yeah, that's a little bit about NICWIC and us as a nonprofit organization.
Sure, great. And then, so in terms of the work that you do, what do kind of the day-to-day operations look like, and how has that been impacted by the pandemic?
Yeah, so we only have 2 staff, myself and Jill Holt. She is out of Omaha, and I work out of my home on the Santee Reservation in Northeast Nebraska. So we worked remotely before, and so like that really hasn't changed anything other than like we were doing a lot of travel before, and now like everything is on Zoom, right? Or
Right.
I don't know, it's like mostly Zoom. I really don't have like a lot of Skype meetings, maybe like WebEx and things like that, but so, video conferencing is where a majority of our meetings are at nowadays, and so so travel has really slowed down, which has been kind of nice because I live so far out from where most of like our meetings take place. It's a lot of travel time, which is really cut back. So other than that, we have, as a nonprofit organization, we had, and we're pretty brand new, we were going to apply for some funding, which the funders had invited us to apply for, and then after COVID hit, they said, no, we're only going to be funding current grantees. And so some of our plans as far as funding kind of got thrown out the window. So we've had to like readjust and relook at some of our strategic planning. And as far as operations and like what we do day to day, we do a lot of education and training, advocacy, so sometimes it seems like meeting after meeting after meeting,
Right.
but really trying to put the Native voice where it's not being heard. We go to, and so that means we go to a lot of meetings and try to, like I said, be the voice for Native children and families, and how can we do systems improvement, systems change. We work with a lot of partners across the state, with Nebraska DHHS, the court systems, service providers. We do a lot of that. We can help with foster home recruitment. We have a program. We train the trainers. We train the leaders that are going to be implementing the TIPS map. We have a Native American TIPS map program where it's for licensing foster homes, foster and adoptive parents. So we have a Native American version of that program, which we've helped create and develop into more cultural competencies, things like that. Sorry, I can go on and on. I'm passionate about the work that I do. We do quite a bit, even though we're a small organization. So, thank you.
No, I think I could probably listen forever. That's awesome. And so maybe kind of broadening out from the overall work of the coalition that you work with there, kind of how have you seen, I guess, the impacts of COVID-19 specifically impact the Native and Indigenous communities that you work with or that you're a part of? How have you seen what do those manifestations look like, the realities of that pandemic? And Kendra, feel free to chime into that as well. Are there any, do you think, unique challenges in terms of, or maybe even strengths in adapting to kind of this challenge of a global pandemic like this?
Yeah, I guess there's a lot. And I was just trying to figure out like where to start with all of that, because, and we were looking, when this all first started, we were looking at like, how does NICWIC fit into all of this? And so we were kind of monitoring what kind of funding was coming down from the federal government, how many cases did tribes have, and how was it affecting child welfare in particular.
Right.
And so, it's just like everything. I think there are some good things that can come out of this. One of the good things that we've seen is that state courts are now doing more, like Zoom calls for the court hearings, which allows tribes, when they have ICWA cases, so then it makes it easier for the tribes to be able to be there and to be a part of those cases. Whereas before it was all in person and they expected the tribes to be there in person. So, say somebody from, if there was a case, a Rosebud case, then the Rosebud ICWA specialist would have to drive like all the way to Lincoln or Omaha or wherever that case was for a 15-minute court hearing, turn around and go back. And so it's, that's one of the big things that I've seen come out of this pandemic. Some of the challenges I think has been access to internet. That was one of the bigger challenges for our students. Not all homes had Wi-Fi or had laptops to allow kids to do virtual learning. And then their parents work and they were continuing to work. Not everything was shut down, and so so I know that was a challenge for some parents to continue to be able to juggle and handle everything. I know housing has always been an issue where you've got multiple generations living in a household, where it might make it a little bit tougher to self-isolate and self-quarantine when needed. Because there's housing shortages all over the place. It's just really hard to get good housing on the reservations. But not just on reservations, but in urban areas too. Some other challenges, I think, I don't know about the testing, but in some areas, being able to get tested when you want to or when you feel like you need to. I know a lot of tribes are doing a lot of really good things to help mitigate the influx of traffic. And so for some reservations, like my reservation, it's a little bit easier than I think other reservations, because for us, there's two ways in and out of the village. One's a highway and one's a gravel road. And so being able to put up those checkpoints to slow traffic coming in and out. They also, the tribes have the ability to do things like that, and then also to kind of have a little bit more control over who's leaving and where they're going and who's coming in and out, things like that. So I know our tribe took a lot of what I think some people might look at as really drastic measures to try to keep our community safe and healthy. So that's some of the things that I've seen anyway. I can talk more about some of those things, but I want to give Kendra a chance to talk.
Okay. Well, I do think that being on a reservation, there's an advantage to being so rural and isolated and secluded from everyone else. But then there's like the problem with traffic and people not from the reservation passing through. Like in South Dakota specifically, there's the Sturgis bike rally that they have up in the hills that was some way somehow still passed. Like they still have that, and there was just so many bikers coming through. And my tribe, I'm not sure why they didn't. We don't have any checkpoints or anything like other reservations, and so that was a bit much. I think we have drive-through testing. I think it's fairly easy to access tests and get one now. And on the radio, on our radio station, every day they do like a run through of stats and like how many cases are in each little community and all of that. I know a few weeks ago there was a few cases in a community and they had that community on lockdown for like 48 hours, so it's pretty good. I think they're doing a pretty good job. They close stores at certain times, like 8 p.m. 8 p.m. Masks are there's a mask mandate. Or the tribal government is doing. I'm glad for that. No children allowed in any of the stores, the grocery stores or anything. No children, no babies, and I think that's good. And yeah.
Right. Okay. And we had a question here that if anyone wants to speak to you from Facebook, and it's asking, do you think like the context of having housing shortages, do you think greatly contribute to community spread in terms of COVID-19, like on the reservation, or what does that look like? Do you think that, yeah, sorry, that's the question, I suppose.
I think it does because, like I said, it makes it harder for people to self-isolate, and then you've got, multiple people living in a household, which, is actually kind of traditional for some of us and some of our tribes. It would be considered traditional, like, because we take care of our elders, and so it wouldn't be uncommon or whatever to it's just something that we do. We take care of our elders, and so it would be and then you might have and just because of, and some of it is unfortunately pure poverty, or just there's just a lack of housing. So I do think it makes it harder for people to self-isolate and self-quarantine when they need to. And I'm not just talking about like on my reservation either, on other reservations. And I know like some other reservations got hit a lot harder than we did, because actually up until just a couple of weeks ago, my tribe only had like 2 cases this whole entire time since March, up until a couple of weeks ago. And then we ended up getting hit kind of hard where it was like starting to be community spread. And so now we're kind of back down on lockdown again and stuff like that. And, people are taking a lot more precautions, which, I wish we would have been doing this whole entire time. But anyway, with other tribes, I know like that, it's probably a bigger issue than some other reservations and some other tribes.
Sure. Yeah, absolutely. Kendra, did you have anything to add to that at all?
No, not really. I do think there are some housing shortages on my reservation and also like on other reservations that I know that's very different.
Right.
Yeah, I agree with what Misty said. The lack of resources, being more rural, things like that.
Yeah, absolutely. And I know, this has kind of been a topic of discussion really since, March and COVID-19 being a reality, at least in the United States here, of kind of, not obviously inventing inequities, but like, revealing at least maybe to an unknowing population kind of some of the systematic inequities that exist based on race and things like that. So do you think, and I guess this has multiple layers to it, but has the response, I suppose, maybe even at the federal level or maybe even a state government level, has that response to COVID-19 revealed or reaffirmed any systemic problems? Whether it be in the work that you do, Misty, or really maybe the welfare on the reservation or anything like that?
I think definitely. I mean, like you said, there's so many layers to this, and definitely, like we've talked about, and I think, and specifically, like there's a lot of buzz about the COVID funding that tribes are receiving.
Right.
But also there's other funding, there's COVID funding that's also going to the states and to other organizations to help fight this pandemic. But anytime that there's going to be something like this, I mean, when we even talk about economy and economics, like I know Kendra had mentioned that all of the bikers going through the reservation and everything like that, like all of those, that's brings in, that helps boost the economy. But at a time like this, like you don't want to see that. Unfortunately, we don't really want to see that. Where a lot of especially our tribal economy really is dependent on funding that comes from off the reservation, or from constituents that live off reservation, or people that come here and may go to our gas station or our casino, or something, or our little dollar store, where that funding is coming from off reservation and from outside of our communities. And so, I mean, we've the economy part of it, I think that's definitely has been affected. And I know as a tribe, that was a big struggle for our tribe, is whether to open up or not, because then that other people are coming in and out of the reservation, and but yet at the same time we had businesses that were closed down. Our casino was closed down. How many jobs was that and having the kind of resources where people can take time off of work for however long, that was a struggle for, I know, several people. But I guess we're still kind of waiting to see how some of these issues affect child welfare. I know that especially in the beginning, and even throughout that, in the time of a pandemic where people are kind of locked down at home, everybody's in the household, and maybe times are tough financially because people have lost jobs, kids are out of school, which means there's more meals you have to feed, and all of that. Like, that's a lot of stress on a household. And then you add on top of that some of the other stresses that may have already been there, but they're just going to become exacerbated, like domestic violence, child abuse, substance abuse, mental health issues. For us as a Native community, we have some of the highest rates in all of those things. Unfortunately, because of the history that our people have, and I'm not that I want to place blame on that or anything like that, but that's the truth. If that's who we are, that's the truth for us as Native people. Those are things that have happened. We can't deny it, and unfortunately, we're dealing with those things. We're still dealing. If people think, oh, historical trauma, like that happened a long time ago, that shouldn't, you just get over it. Well, no, it just doesn't happen like that. I mean, those social issues that we deal with today are because of the trauma that has happened to us as Native people. And so, I mean, there's all of those issues that we already have the highest rates of. And then everybody, like I said, everybody is kind of crammed into their house and, not supposed to leave. And I know that was really tough, especially for our young people, like to not be outside and to do things that they normally do, like play basketball. Those are healthy things. Or to play any kind of sports. But so when you put all of that together, it just exacerbates the social issues that are going to arise. And so I know that there was a big concern of child welfare, in terms of child welfare, of a huge rise of child, of cases or issues not being reported because schools, daycares, those are the ones that have the higher, they do a lot of the reporting. And so if kids aren't in school, how is anybody going to know what's going on in the household? Well, then, and then so once schools open back up, so then there's a concern there. And I had mentioned already about the having the adequate resources for the educational system, for our kids to continue to, to learn as they can and they should be. That's been a concern of mine since this whole thing has started too, because I know, like in terms of like even comparing the schools that are around here, some of the schools where we're continuing to push their students and have homework and everything, like it seemed like everything transitioned pretty quickly to online virtual learning. And then some of the other schools not so much, where because students didn't have access to internet and laptops and all of that. I mean, now they've done a lot of work, at least our tribe has, and making sure that there's Wi-Fi available, and the schools have bought more laptops and all of that. So, where they have that access to the resources that they need for online virtual learning. I don't know. There's so many, there's so many systems, and we could talk about each one of them. But Kendra, did you have any thoughts on any of that?
Not really. I do agree that it's been a lot of grief and trouble with school and kids attending classes through Zoom and not having access to laptops, Wi-Fi, me being one of them, the Wi-Fi. I live in the country. I don't live in a neighborhood or anything. I live pretty far away from any community, a good bit away. Yeah, there are some issues with that.
Yeah, sure. And so I think, everything that's been happening in the context of 2020 and what that's brought in terms of kind of the United States collective consciousness and what we're discussing as a society. I think one of the biggest things too, this summer with the murder of George Floyd, talking about Black Lives Matter movement, and seeing protests and demand for change systematically is something that we're seeing, across the United States and across communities. And so I didn't know if there were, when we talk about, systematic racism being at the forefront of kind of the minds of many Americans at this point, if there are any parallels that can be drawn in the Native and Indigenous communities, in kind of that context. Kendra, what do you think about that?
Parallels. Yeah, I do think there are some parallels with all that, the Black Lives Matter and all of those horrible tragedies that have happened across the nation. So many families who've lost some other people. And I noticed in the movement there were some other cases that surfaced. I don't remember their names. There's like Native men also being wrongfully murdered in that way, in that sense. And yeah, I did enjoy seeing the younger generation, the natives like me, my age, the youth, making posts on social media about Indigenous and Black solidarity. I like seeing that, like, that unity. Like we're all not that different in our struggles. Like yeah, and yeah, I appreciated that.
Sure. Misty, what about you? Do you think there's kind of some parallels in narrative that can be drawn here?
Oh, definitely. Like she was saying, there's things that have happened to the native population that is really similar to that. And unfortunately, it seems like it doesn't get as much publicity as like the Black Lives Matter movement, which I'm not saying that like that, put that down or anything. Like, I'm just saying, like, it just doesn't seem to get as much publicity because, like, we had, there was a case kind of really similar, well, kind of not really, but it was a Native man in Omaha, and his name was Zachary Bearhills, that got killed. And he did have some mental health issues, but he was tased, like, I don't know, like a lot of times by law enforcement, and he ended up dying. And so there's things like that, and you just don't see as much publicity about that. You don't hear about it very often. I kind of follow that kind of stuff, but I think the general public doesn't even know about those kinds of things. So it was good to see, like, when like the George Floyd thing, and all of the Native people that came out and supported that, and also to to help protect in the Minneapolis area. And we had taken we were up there for something, and we were just kind of driving around and happened to come across this mural that was done. It was an abandoned building, and it was a mural that was done, and it was really cool because it had one of our tribal leaders, tribal warriors. His name is Gawangsa, and he was one of the 38 warriors that were hung back in 1862. So that's what caught our eye, was because we had recognized him and who he is, knowing that. And then there was also George Floyd on there, and I can't remember who else, but I thought that was a really cool mural. Whoever did that, like, it was really awesome, and it was very impactful. The statement that they were making was very, very impactful. So, I always think about, like the like Black Lives Matter, and the movement. I mean, even going back to the civil rights movement and things like that, like that had a positive impact on us as Native people. And so, and even in the work that we do with NICWIC, we try to partner with other people in communities of color to, because it's going to strengthen us, it's going to strengthen our voice. So I think it's really important that we stand together, and we work together, and we support each other. So I wanted to say that. And then there's this other thing that I came across that I thought was really interesting, and I was blown away by it. It's an article on it says federal investigation finds hospital violated patients' rights by profiling, separating Native mothers and newborns. And this was in New Mexico. And this article is from August 22nd, 2020. And so what they're talking about is that pregnant Native women were being separated from their newborns for COVID testing, without even being told. And I was blown away by that. I was like, what the heck? And then it's like a flashback to things that happened to Native women many, many years ago, where they were being sterilized and not even knowing it. And so I was like, and so this is 2020. I mean, you wouldn't think things like this would still be happening, but it is. And um, and so it just gets back to, the systemic racism that continues to happen to our people. And so I wanted to bring that, and I can, let me see. I'm just trying to read where this was published through ProPublica.
Sure. Okay.
But anyway, it was in New Mexico.
Yeah. Gotcha. Yeah. I mean, I always keep catching myself nearly with everything. Like, it's 2020 and we're still having to have a lot of these conversations and like just the pure parallels, things that were happening, hundreds, decades ago, whatever timeline it is. Yeah, that it's 2020 and we're still having to have these conversations. Yeah, I think too, maybe even separating a little bit out from COVID, and maybe Kendra, you can speak to this a little bit. What do you think? What are some of the other ways that systemic racism impacts Native and Indigenous communities, maybe on and off the reservation? For those that don't live on a reservation, how do you, what does that look like?
Well, what came across my mind listening to these, we're talking about a protest that happened just a few weeks ago with the monument called Mount Rushmore. Yeah, what the defamation of one of our sacred sites. It's originally, the name is Khangashila Shakbe, the six grandfathers, until they carved into it and put those faces on there. And they had that. A lot of Native people came over there and they made a blockade to stop the POTUS and all those people coming through for their big rally, all of that, and some protesters, those land protectors arrested, and it's a little crazy thinking about it. It's our land, that's our sacred sites. There was talk of the treaty that was broken many years ago in the 1700s. All of that, we legally we had a right to those sites, and we have claim to them. Yeah. No dapple way back at the beginning of my high school career is when those protests happened. I was a little too young to attend them. I was only 14. And I know that one of our water protectors, Red Fawn, she was released. She's out of incarceration just yesterday, I think. Right. 4 years she spent there, my entire high school life. Now she's out. Yeah.
Wow. Yeah, thanks, Kendra. Appreciate that. Yeah, Misty, do you have anything maybe to add in terms of how maybe even in the child welfare realm, how systemic racism kind of manifests and how you combat that day to day?
Yeah, I do have some thoughts on that. We were actually just talking about this yesterday. I was on a call with, we have a tribal, state, and federal court consortium. And so we did some listening sessions, and we were reviewing what we heard back from those listening sessions. And it's all probably the same stuff that we heard probably 30, 40, 50, 60 years ago. It's a lot of the same thing, which it gets so frustrating, that we're still talking about the same issues over and over and over. And, one of the main things that was a common thing that we kept hearing from people is unequal representation, courts not being fair, not feeling like they have even a fair shot in court. And then, of course, that gets into ICWA, in Indian Child Welfare. I apologize. I don't know if I need to explain like what ICWA is. It's the Indian Child Welfare Act. It was passed in 1978 because of many children being removed from their homes and adopted out. But anyway, and so of course that ICWA cases become affected by that. We hear some of the families that we've worked with, and it just depends on where you're at. Okay, so we're in the state of Nebraska. Kind of depending on where you're at, even within the state, what kind of representation they're getting. Are they getting good representation? Are they? We tried making a list of attorneys that have a good understanding of ICWA, and that list was very small, for the entire state. And so, if they don't know and understand ICWA, like how are they supposed to make sure that it's followed, or make sure that the state is following it and the courts are following it and all of that. And so a lot of times I find myself educating attorneys, even one-on-one, if they have a case, and I always have to tell them I'm not an attorney, because I'm not an attorney.
Right.
But here are the resources. This is what ICWA says. These are the things that need to be done. And so we see that quite a bit in terms of, across the state. And like I said, in some states or in some areas of the state, it's different. It's worse. It's like Western Nebraska. Some of the things that the families that we've worked with in Western Nebraska is pretty horrific. And, which is pretty scary, because some of the families that we've worked with knew enough, they found us as a resource, and they were a pretty good advocate for themselves, kind of having some education and knowledge and understanding of how systems work and all of that, and knowing that this is not right, this is not okay, that how their family is being treated and run through the system. So this is a family that is pretty good advocates for themselves. What makes me scared is that there's a lot of families that don't know how to do that. They don't have those resources. They wouldn't know, maybe they wouldn't know about us or whatever. But and to know and to have enough confidence to speak up and say something. And this family that we were working with, just blatantly right in the courtroom, things happening of racism right in the courtroom. And one hearing in particular, I remember we were on the phone, meaning the tribal ICWA specialist, tribal attorney, and myself. And then kind of once they handled the ICWA stuff, we all got off the phone. Well, then they were, later on, he was telling me that, all the things that were being said and all of that after we got off the phone, they waited till we were off the phone. And then the racism came out. And I was like, oh my gosh, I knew I should have stayed on. But, in the court systems, there's so much of, unfairness, not having equal representation, not feeling like you're getting treated fairly. Even, how what's being charged and how things are charged.
Right.
And I guess I can go on and on about it too, but because there's just so much. And okay, one more thing. Sorry.
Yeah.
So I'm on the Nebraska Children's Commission, and I was in a meeting, and we were talking. This has gotten a lot of, there's a lot of press, there's a lot of social media about it, and it's kind of at the forefront now. Some of us have been talking about disparities for forever,
Mm-hmm.
And now it's becoming more to the forefront, which is a good thing. Not gonna disagree. Like, that's a good thing. But and so in the meeting, they went around and they were asking, like, how have we been staying sane during this pandemic? And then the other thing was, what have you been doing to educate yourself or to help yourself with the racial and ethnic disparities issue? And mostly everybody answered, what they've been doing to stay sane with COVID. But there were a few people that had answered, and one of the members, she is from Omaha, and she's on there because she's an adoptive parent. Well, she's white, and the foster and adoptive children that she's had are white. And so she made this comment in this statement when she did say she's been reading White Fragility, right, by Robin DiAngelo, which is an amazing book. Like, I've been listening to it as well. I don't have time to sit and read, so I listen to it on Audible. But she made a comment about her adopted child, and she said that she's been through so many things, and because they were talking about the juvenile justice system, and she made this comment of, would her daughter probably should have been in, gotten some sort of charges or been maybe even in a youth rehabilitation treatment center or something. But she said, would that be different if she wasn't white? And I was like, wow, that I was really impressed with how she brought that out herself. It is different. If a person of color is stopped versus a white person, if they're stopped, what kind of charges are they charged with? It is different. And so, anyway, I wanted to throw that out there, and we get asked that sometimes, like, what can we be doing as, with the current climate and, the Black Lives Matter movement and all of that. And that's a really good resource, White Fragility by Robin DiAngelo. And I give a shout out to my friend Colette Yellow Robe for introducing me to that book. It's really good.
Yeah, you swerved right into my next question, which was, I think there's a lot of, at least perceived momentum with people having these conversations. A lot of it you just see on screen, so you never really can see how much is happening behind. But my next question to you both would be, what are things that, like non-Native individuals, such as myself, can do to support Native and Indigenous communities, whether it be like COVID specific, but also just in general?
Gathering my thoughts.
Yeah, take your time.
So like I said before, that book, White Fragility, I opened it up so I could read to you what it says. It says, why it's so hard for white people to talk about racism. And it's just a really good book, and she makes you see things way differently and to think about things that are, way differently. And I was I was like, oh wow, I never thought about it like that. So that's a really good book and a good resource. And I think there have been some other things that are online. I know we've had some discussions. There's Project Everlast had a 3-part series on anti-racism and microaggressions, which was good, things like that, and which has kind of been sparked because of the BLM movement. And we had a good discussion about that. Like, at that point, we were talking about how to implement that in our daily lives and what people could do, or what were they going to do differently. And I'm just all about diversity all over, because when you get diversity into the room, you get diversity of thinking. and different experiences, and with those different experiences, it comes a different way of thinking about things and looking at things. So, I'm all about that, diversity everywhere. So, but I'll let Kendra add in, and I'll see if there's anything else I forget.
Alrighty. Well, on the topic of microaggressions that you brought up, that vocabulary, and I'll admit I just learned that word maybe a few months ago. Taking advantage of quarantine, and all of these terms, very helpful. Seeing all these social media platform threads, expanding, and some microaggressions related to Indigenous peoples that are often I see a lot with non-natives to us would be maybe blood quantum, that topic, very touchy topic. How like what percentage of native are you? How native are you and all of that? Like you don't look native. Kind of have that box they sort of put us in. Makes really uncomfortable question.
Yeah.
Native person, because it's really weird. We're like the only people that have that system, that blood percentage on our ID cards. A little weird. They have a term for it in Lakota, Iyeska, half blood, half breed, all of that, and then versus full blood. Then it's a hurtful question. Also, I guess there's also like the problem of people claiming Indigenous roots and heritage and actively identifying as Native, and it's really like the Cherokee princess. My great grandmother was this and that, all of that. And really weird, and all the mascots, those faces like we're not a mascot. I know the Redskins took away that name. I think that's good. I think like when people who like in the comment sections I see like I'm not bothered by this. I'm Native. I claim to be Native, and I'm not bothered by this. I see a real big problem with that because like I know that the people who write this, they obviously see that there are Natives who are bothered by it, and I feel like their feelings should be taken into account. Like maybe it doesn't bother me, but it bothers a lot of us.
Right.
That's important to look at. And another thing I want to mention is like that I see often is the homogenization of Native peoples, like grouping together, and like really, I really value and appreciate when like people specifically call out what tribe they're referring to, instead of saying like, oh, this Native American thing and all of that. Like we're really like different. There's maybe thousands of Native American tribes, some not. There's 560 something federally recognized tribes, and that doesn't take into account of the not federally recognized tribes. That like some people aren't like federally, or like the government doesn't see them as a tribal member, so maybe they have to put mixed or like some other ethnicity that they can put on the little checkbox and all of that. Like they put this together, and like they don't notice that Native people, like we all have a different culture. We're all like unique. Like, maybe we are the same in some way. Like, our practices about like animism and all of that, like all things with spirit, things like that. But like dream catchers are specific to one tribe's totem poles, all those. I think that's an important thing to not homogenize them. And group us together in that way. I guess I could mention another thing. I don't see it a lot, thankfully, at least to me. Talking about Native in past tense, like they're already extinct. I've never like encountered that like, verbally in real life, but I know there are some Native people who have experienced that. Like you're sitting right there, and then another person is talking about your people in the past tense while gone. Yeah, that's a horrible situation to be in. Hopefully, I don't ever go through that myself. And, Misty say a few things if she wants to.
I was just sitting here thinking about when I was in school, and you know, you mentioned like the mascot issue and all of that. Like, I remember we had some pretty good discussions about that when I was in college, and I'm just sitting here, I'm feeling old because you guys are like all young, and and you know, it's cool that you know now they're removing, you know, like the mascots issue is kind of going to the, you know, getting taken care of, like, you know, like they're changing mascots and things like that. And even like we were talking about this the other day, like the Land O'Lakes butter, you know, it's no longer like the Indian princess on the Land O'Lakes butter. And then even going into like Uncle Ben's rice, and Aunt Jemima, syrup, you know, stuff like that. Like, you know, all of those things are changing, which I think is really, really awesome and really cool. Because I remember we had some pretty intense discussions about that when I was in school, when I was in college, like 20 years ago.
Right. And so kind of as we're gathering kind of the end of this conversation, and I like, Misty, you talking about, you know, these conversations that you've been having, but them kind of coming to fruition and action actually be taken. We had someone ask really early on when we started this, and I'll direct this towards both of you because I think it's important to celebrate joy and accomplishment in our lives. But the question is, Misty, what is your proudest achievement? And Kendra, I'd like you to answer that as well as we roll out this hour. But so whoever, I mean, it's a lofty question, but whoever wants to answer.
I think you know, in terms of like my career, it's been a Champions of Change award from the White House. And when President Obama was in there, I got a Champions, well, myself and our DV program for our tribe got a Champions of Change award, which was freaking amazing. You know, unfortunately, I didn't get to meet President Obama, but or Michelle Obama, but it was pretty awesome. So that's probably my biggest accomplishment as far as my career goes.
Sure, that's awesome. Kendra, what do you think?
When I think of that, like in regards to education and in that context, like, I could say going to college. Then first year, all of my grandmother, my mother, they went to tribal colleges. They stayed on the reservation, and I feel like there's a bit of a distinction from that because they worked jobs. They had their kids. My mom, she had me while she was going to nursing school, getting her associates. But me, I'm going across the country, I am across the country currently. So I feel like that's a really big thing. An institution, PWI, predominantly white institution, here with the ethnic population, mine, Native Pacific Islander, being the very, very smallest here. But that's just in that way. But when I think of my greatest accomplishment, I think of culturally. I think I'm really proud of me for being able to speak the language. I don't see too many my community, my kids my age, be learning and all that. Like I try to speak. I try to like take some time to go through my pronunciation and all that. I'm fortunate enough to have fluent speakers in my home. And growing up with that, my mom was fluent, my grandma, all of them. So privileged, advantaged in that way. And I just started dancing, sun dancing, like my mom. And soon, which wow, I'll be a jingle just dancer. I just received my dress maybe a week ago, so starting a bit late, but I plan on while I'm quarantining, in here dancing in my dorm small space, teaching myself how to dance. I mean, I did dance, but I feel like everyone says like I used to dance. I used to dance Tiny Tot and Kitty Guys. I danced. My mom had me in a little Jingle Just dance, Jingle Just Regalia. So I'm excited about that. So I'm culturally aware and having a voice is what I'm really proud of.
Awesome. Yeah, I mean, I don't think I could see a better use of Dartmouth quarantine, you know? That's awesome. I love that. And as we're kind of wrapping up here, do you all have any final thoughts or shout outs that you want to make? Any?
I just wanted to commend Kendra. I think that's awesome, and I totally agree with that. And you know, I think that is what makes us as Native people like even more successful is when you are strong in culture and you know including language, and then you've got the education on top of it, and makes in your female, you're a triple threat. And I love that for you. You know, some people, you know, ask about what has created, what has helped me, and that's, you know, that's what it has been for me is to have that. And I've been fortunate to learn my language. You know, I didn't grow up with speakers in my home, but you know, and my mom and my dad and some of my grandparents, they knew the language with me, and my grandpa, he wouldn't speak it. You know, for reasons that were known to him, and I understand that now. But anyway, I just wanted to thank you guys for having me on Inclusive Communities. This is awesome and amazing, and hopefully we can work together again in the future. And you know, again, I want to mention NICWIC as our nonprofit organization, and as a nonprofit organization, you know, we do a lot with a small amount of staff and funding, and so however we can work together and you know to improve the lives of Native children and families, just let us know. Thank you.
Yeah, absolutely. Thank you both. Kendra, do you have anything to say?
Not really.
Hey, I'm into that. Yeah, thank you so much, Misty and Kendra, for sitting down virtually with me. I really appreciate it. And yeah, I look forward to having some more discussions with you all. And Misty, for sure, I would love to kind of see more ways that we here at IC can support you and the valuable work that you do. And Kendra, again and again, best luck freshman year. You're going to do great. And let us know how we can support you too. So, all right, thank you both. I'm gonna end it now. Awesome, thank you all.
Thank you.